So these are beautiful babies that have arrived safely because their parents were educated and empowered with evidence-based information and education on Count the Kicks, which is a fetal movement monitoring program in the third trimester. Um, well, thanks to the Anthem Foundation for being our funding partner. So, we're going to talk about resources that we have. Our app is free. Our nonprofit provides the app that we're going to learn more about today. But there are other resources like print materials and programming work that we do in partnership with Anthem in LA County. So, as a quick disclaimer, we are going to be talking about stillbirth, and it is a difficult topic, and it may be a sensitive topic for those of you in the room. And so, just wanted to make sure that you understood we are going to start our conversation sharing via story and the statistics around stillbirth and help. And focusing in on that stillbirth crisis, we have to know and understand that there is a problem and what that problem is. So we're going to start there, and then we're going to talk more about solutions and why Count the Kicks is a part of that conversation. My name is Jen Rowray. I am the Director of Advocacy Engagement for Healthy Birthday, which is the nonprofit creator of the Count the Kicks campaign, which is a stillbirth, proven evidence-based stillbirth prevention program that was started in Iowa. And that's where I'm sitting today. I sit in Des Moines, Iowa, and our organization was founded by five courageous women who lost daughters, four to stillbirth and one to infant mortality. And at the time of their loss in the early 2000s, they were told that stillbirth was as rare as getting struck by lightning. One of those individuals was my neighbor, and she experienced the loss of her first child as I was pregnant with my third. And I remember being very impacted by that experience and just wanting to join and champion that background. In my role, I want to make sure that I center the lived experiences of those individuals like our founders who are true heroes and change makers by wanting to address this crisis and do better for families. And so I'm really reaching out in partnership with you. So I just came back from Washington, D.C. Friday was National Stillbirth Prevention and Awareness Day. And via it was a perfect champion. LA, the city of LA proclaimed it the city's Stillbirth Prevention and Awareness Day. They lit up their City Hall, and we also had the waves on the San Diego Convention Center lit up to remember and honor families and babies. So, without further ado, I would love for Via to take some time to introduce herself, to share her story, her why that she's here today. Via?
Thank you, Jen. My name is Via Klein. I'm the California ambassador for Count the Kicks. Thank you all so much for letting us talk about my story and the great work that Count the Kicks does. The work I do at Count the Kicks is in honor of my firstborn son, Victor Elliott, who was stillborn last year at almost 34 weeks in 2024. In addition to reaching out to expectant moms, with the information that we try to provide with Count the Kicks and the free app and paper materials, we also strive to educate providers and make education consistent with Count the Kicks. During my ultrasound appointments, I was given cold juice, for example, to try to make Victor move around. And after the fact, I now know that that is a myth. Cold juice does not actually encourage movement. And if I had been more educated in the importance of kick counting, I would have felt more empowered and confident to go to my provider when I felt Victor's movement slow. Um, with good news though, it's been a long, tough journey trying to um, educate myself more about what happened and understand the role that I want to do now with Count the Kicks to help other expectant parents avoid the same tragedy. I am actually pregnant with my rainbow baby, and this is a great opportunity for me to use Count the Kicks in this new pregnancy, and I'll definitely be doing that once towards the end of my second trimester. And so I'll turn it back over to Jen to go over more about the resources we provide. Thank you.
Thank you, Via, for sharing your story and sharing Victor. And please jump in as you have moments that you think would be valuable in bringing your experience to the conversation. And thank you for sharing or celebrating Via. And we are all definitely rooting for a healthy outcome for her in this rainbow pregnancy, which is oftentimes what we call pregnancy after loss. Those rainbow pregnancies are difficult emotional and physical journeys. She is now navigating a high risk pregnancy. And so just keeping in mind that if you are serving someone in Via's shoes who has experienced loss, that this is also a time to be especially astute and aware of that high risk nature and the emotional nature of that pregnancy. So let's see if we can get my screen to move because right now it doesn't seem to want to do that for me. There we go. So stillbirth. Let's learn the facts. Let's understand what stillbirth is. Stillbirth is defined in the United States is defined as the loss of a baby at or after 20 weeks of pregnancy, a baby in utero that never takes a breath earthside, but is very much loved and wanted. Living baby until something goes wrong in the pregnancy. And there are lots of reasons for stillbirth, and we won't really dive into the science behind that. But unfortunately, in this country, a lot of individuals do not find the answer or the cause, which is really an important thing, both in their closure and healing in their grief journey, but also in their medical history. They lose a piece of medical history when we don't have the answers. So there are over 20,000 stillbirths on average each year in the United States and annually. That's almost 60 babies a day. Think about 3 busloads of kindergartners. If we saw on the news that there were 3 busloads of kindergartners dying every day in a school bus accident, we'd ask questions like, why is this happening? What are the safety issues? Are there prevention methods? What do we need to do to improve this? And that's the same questions we want you to ask around the stillbirth crisis because we know at least 1 in 4 stillbirths are preventable. And I believe that number is, I believe, and I think the state of Iowa has proven that number is minimal. In the state of Iowa, where Count the Kicks was created and implemented in the first 10 years of the campaign. There's a study that's been published in BJOG, the British Journal of Obstetrics and Gynecology, and AJOG here in the United States, showing a 32% reduction in our state's stillbirth rate in the first 10 years of this health literacy campaign. Nowhere else in the country has seen that type of success in addressing preventable stillbirth. Not all stillbirths are preventable, so we want to be very clear that stillbirth is going to continue to be something that families experience. But for those that are, where Via was sharing, she believes that if she could have caught that early warning sign, had been educated, empowered, known to speak up, she believes that there was an opportunity for medical intervention that could have brought Victor here safely. Those are the pregnancies that we want to make sure that we're catching. So, and I think another astounding statistic is that stillbirth moms are oftentimes told that it's as rare as being struck by lightning. Our founders, multiple ones of them. I hear parents hearing this from their OBs or nurses regularly. That is just statistically not true. Actually, stillbirth is more common than the top 5 causes of child death combined. And so it is not rare. It is actually something that's happening in American communities way too regularly. So, some things to know. Stillbirth can happen even in low risk pregnancies. Oftentimes, stillbirth happens and then you become a high risk pregnancy. So it is not education that's just for that rainbow pregnancy. It's not education that's just for high risk moms. This is education that every expectant parent you interact with deserves to have. It can happen in both low and high income settings, although we know that the rate of stillbirth is higher in rural areas and socioeconomics matter. Outcomes are also impacted by your barriers to access or the resources that you have. 35% of US counties actually lack birthing facilities in this country. And so that's a real maternal health crisis that's happening nationwide. We also know that there is an increased risk of having a stillbirth if you fall in certain categories. And we're going to talk a little bit more about that on the next few slides. But if you are serving a client who is at advanced maternal age, that 40 plus age range, statistically higher risk of stillbirth. If you're serving teenage parents, statistically higher risk of stillbirth. If you're serving IVF clients, higher risk of stillbirth. These are all categories of risk that we just need to raise a flag for, and those pregnancies need even extra education and support. Unfortunately, in the United States, every 1 in 185 pregnancies actually ends in stillbirth. There are vast differences in outcomes based on the cultural group that you're a part of. In every 197 Native Hawaiian or other Pacific Islander pregnancies, stillbirth is occurring. Think about that number. Every 1 in 97 births. For Black pregnancies, it's every 1 in 100. Indigenous, 1 in every 139. For Hispanic pregnancies, it's every 1 in 216. For white pregnancies, 1 in 223. And for Asian pregnancies, it's 1 in every 270. And so that gives you a lens also in risk factors just based on your cultural background. So we want to make sure that we are reaching the most at-risk populations, which is a big part of your job and your role. And so that is why we're in the room to talk about these harrowing numbers. In California, there are over 2,000 stillbirths every year, 2,000 families that are impacted by this crisis. I don't think that over 2,000 individuals get treated for lightning strikes, right? Like this is way more common. That means that your stillbirth rate in your state is 5 babies per 1,000 live births are lost to stillbirth. So thinking about the number of clients you serve each year, you can almost statistically estimate how many times this will happen. And perhaps some of you, unfortunately, have people that you serve or people in your lives that have experienced stillbirth. What we believe, if we were to save 1 in 3 at-risk babies in the state of California, like we are in the state of Iowa, we believe that 686 of those babies can come home safely. That's huge. That's totally worth the work because we believe that one life is priceless. So stillbirth data in California, just to narrow it in just a little bit further. California's, and this is 2022 data. What I just shared was the 5-year average on 2020 for that came between 2019 and 2023. So this is a little bit different timeline, I suppose, but it shows you where California rates in comparison to the United States. I know California cares very much about maternal health and has great programs like yours that are really making an impact and driving that rate lower than the national average. So a big kudos to all the work that each of you are doing in your state. But this just shows you a little bit more of a lens for what's actually true in the counties that you are in the state that you're living in. So just looking at that, you can get a little bit more data for review. The other thing that I think is really important to understand is there's a lot of conversation, as there should be, about maternal mortality and morbidity in the United States. Mortality being death of someone who loses a baby or carries a baby up to the first year after delivery. And we know there is a significant tie between severe maternal morbidity and mortality and stillbirth. So a mom that gives birth to a stillborn baby is 4 to 5 times more likely to die herself, or 7 times more likely to experience a severe health crisis. And just thinking about that, you can see the pictures on the right-hand side. Unfortunately, a year and a half ago, Crystal Edwards lost her life. She was a Kansas City Chiefs cheerleader. You may have seen her story on the news. She had lost her second child to stillbirth and died of sepsis shortly after delivery of that second child. My good friend and the Arizona Count the Kicks ambassador, Sean Similis, is pictured with her beautiful but not breathing son, Zach, in the bottom corner there. Notice the ventilation machine. So Sean experienced a placental abruption And Zach lost his life, and Sean still continues over 10 years later to experience her own health issues. And so we know that if we can prevent a stillbirth, we might also be saving a mom. So we want to do that. I know we all want to see good outcomes. We also know that stillbirth not only has serious physical effects on families, just the lifelong psychological effects on them and prolonged grief and complex grief, the economic burden in this nation. There's some things that maybe you know and maybe you don't know about what happens when a stillbirth occurs. But not only are you paying for the birth of that child, because whether they survive or not, you pay for their arrival, their delivery, but you also are faced with decisions about what to do regarding that baby. So there's burial costs, cremation costs, and decisions, really important decisions, and financial costs right away. In a lot of places in this country, if you deliver a stillborn baby, you lose your maternity leave because you don't have a baby to care for. What's horrifying is that their body did the same exact thing, whether their baby took a breath or sight or not. And we know they have a higher risk factor for poor outcomes as a woman, but many of them are forced to lose a job or go back to work way before they're mentally or physically ready to resume duties. And so we really do have some things in this country we want to address. This is Erica Bailey, her son Roan, who was stillborn, a first pregnancy, and her husband Brad. And you can see the devastating impact. The reason I highlight Erica's story is because it doesn't have to be this way. And that's where we want to spend a majority of our time. This is Erica. She experienced a rainbow pregnancy pretty quickly after the loss of Roan. She did not know about fetal movement monitoring. She did notice a change in movement. She went to Dr. Google. She went out there trying to learn, like, is that important? Like, it feels like my baby's slowing down. But I've never been taught or educated about this. And she was reassured that babies run out of room at the end of pregnancy, that they slow down as they settle down for birth. Unfortunately, those were deadly myths that are out on the internet, and myths that we are going to talk about and break. Because she was educated and empowered, she used Count the Kicks in her second pregnancy, because moms who lose babies go into a deep well of research, and they learn and educate and empower themselves. And Erica did that, found Count the Kicks, used it, and actually at 36 weeks pregnant, noticed that her rainbow son, Bear, changed his movement. His movement pattern changed. He'd slowed down. She now knew that that was an important warning sign, that she should speak up. She felt empowered to do that. The app had the data for her to have that conversation. Her doctors listened to her, investigated, and Bear did need to arrive a little bit early, but arrived safely, and is an example of a Count the Kicks baby save. And in that far right-hand picture, you see a beautiful 5-year-old, actually 4-year-old boy in this picture, that came to Iowa to celebrate at our Changemakers Luncheon. I just want to encourage you that I get the blessing of hearing these types of stories as well. And I want that story for everyone. So, and I know you do too. So why do we want to talk about fetal movement, and how does it prevent stillbirth? So Count the Kicks is a highly effective evidence-based stillbirth prevention program developed as a proven early warning system. I want you to keep that word in your mind, and we'll talk about it in a minute, for expectant parents. We have saved lives. I didn't update this, but now it's 38 states and 8 countries. I actually got to have a Zoom meeting with a woman in Turkey just recently. So our app is free, downloadable, and available in across the globe, and over 140 nations we've had app downloads. So research supports fetal movement monitoring. If you've experienced pregnancy, I'm sure you've had the question in the 3rd trimester, is your baby moving? Well, the answer oftentimes is yes. If you felt your baby moving, you'll say yes. But do you know what your baby's normal is? Has that movement changed? Were you educated enough to know that that could be a warning sign? And that's where that gap is. And this is what we want to do. We want to improve that education and awareness. So we know that fetal movement is education can be associated with a reduced risk and outcomes. So, not only do we want to identify those pregnancy complications that could threaten a mother's life, we want to make sure babies stay in utero. So, we are not encouraging early deliveries, but we do encourage that investigation. Better an early delivery than a stillbirth delivery if we have a chance to intervene. And we want to reduce those NICU stays. Our own CEO is a living example of that story. Her baby's movement changed at 30 weeks. She mentioned it to her doctor. They investigated. Unbeknownst to her, she was actually in active early labor. Her body was trying to deliver him at 30 weeks, which is very early, as you know, has some severe risk factors for mom and baby. But because she noticed that warning sign, she spoke up. They were able to intervene, medication, bed rest, a hospital stay. And her son, Hayden, who is now 15 and just traveled to Washington, D.C. as living proof of Count the Kicks, stayed in utero to the 40th week of pregnancy, had no early delivery or NICU stay, and is a very active, healthy 15-year-old. So Mabel is one example of our Baby Safe. If you want to have a good day, go to our Baby Safe page on the Count the Kicks website. You can read story after story where empowering and educating mom and filling that health literacy gap helps to bring these babies home and to save moms' lives as well. So Mabel's mom was saying the only red flag she experienced in her pregnancy, a completely healthy pregnancy, was her daughter's change in movement. And she's grateful that she understood the concrete data in that app. She had it. She could use that to be confident in speaking up, have that important, empowered conversation with her provider, and have that investigation implemented so that her daughter, I'm sorry, could get here safely. So why does movement matter? Movement is one very important way, and really the only way that baby has to communicate with mom. And so, knowing that, we want to make sure that we also understand that a change in a baby's movement can be an early warning sign and sometimes only warning sign that a baby may give and when they're in distress. Heart rate is the last thing to change and the last thing to go. You have a heartbeat until you don't. So if baby gets in serious distress, it will impact their heart rate, but then we're talking serious distress. So we want to catch that early warning sign that, something may not be just right. We also know that moms that track their fetal movement, 84% of our app users, as we've studied our app and the app responses, state that it gives them feelings of bonding with baby. And we know that prenatal bonding can be really key in that hard postpartum, that fourth trimester when you bring home a newborn. So we want that prenatal bonding in hopes that we'll maybe even reduce those childhood ACEs. But for anyone that counts their kicks, they get to know. I hear from moms regularly who say, I knew when my baby was born they were going to be a night owl because at 11 o'clock every night they were super active. So once they got in tune with that movement pattern, they really were connecting with that baby. It's really important in those rainbow pregnancies. Moms will self-protect, and it's more difficult oftentimes for them to bond with that baby at the same level because their concern for loss is real. And so this also helps them reconnect. And I've had conversations with many moms across the country that use the app in those rainbow pregnancies. And not only does it help them bond with that baby, but 77% of our app users actually indicate it helps them be less anxious, right? Because they now are having that touch point. And like Dr. Alexander Hiesel, one of the most prominent researchers in stillbirth, will say is like, now we're getting the right mom at the right time. Because if they have that touch base and they know things are going well, they don't need to come to the hospital to have that investigated. They don't need to have that anxiety or that worry. But if they notice a change, they're going to be empowered to go to the hospital. And now that doctor, that provider has the opportunity to do the proper investigation. So getting the right mom there at the right time, easing those anxieties. We know mental health and pregnancy are really important conversations. So we'll continue to think about that with you as I talk about features in the app. So we do have our Hallmark tool is a free downloadable app available in many languages. So let's talk about how to count the kicks. Even if you're using the app, you're using a paper kick counting chart, there are some reasons we count the kicks, why, and when, and how. So let's talk about that. So when should an expectant parent start counting movements? We want them to start counting at 26 weeks in high risk pregnancies. So if they've identified as high risk, Via will be counting her kicks at 26 weeks. For normal low risk pregnancies, that would be the beginning of the third trimester, which is 28 weeks. I want you to hear this. Quickening, that early movement happens much before this. We want them to be in tune with movement from the very first flutter, and be aware of that movement and starting to recognize that movement and how does it feel. We still want them to be in tune before the 26th or the 28th week. Why do we recommend really starting to track that movement at this time? Well, that's when baby actually starts to build a pattern, a sleep and wake pattern that can help develop that normal, that moms can recognize. It also is when moms can really start to feel those movements regularly. So in the beginning, you may not be feeling all of the movements, because of how light, they are. But by the 26th or 28th week, almost all pregnancies, moms can feel that. You will hear an exception every once in a while. Those are women who have anterior placentas. The placenta is between, their belly and their baby, and that can, slow down how soon they start to feel movements or how strong they feel those movements. So if you do have a woman that you're serving that says they have an anterior placenta, it may take them a little bit more, time, and it may also take them a little more intentionality to get in tune with that. But certainly, at some point in this time period or a little after, they should feel that. So here's what we want, every expectant parent to do starting in the third trimester. We want you to monitor your baby's movement every day, preferably at the same time each day. So we want them to identify a time that they are normally noticing that their baby's active. Like, oh, I notice that every day after lunch, my baby's normally active. And I have a break, so this is a good time for me to count my kicks. So we want them to find a time they know that that normal wake sleep cycle is happening. We want an awake time, and we want them to stick with that. So if they normally count at 7 o'clock every night after dinner, we want them to stay in that 7:30 after dinner time frame. Once a day is plenty. I know that a lot of expectant parents, especially in that rainbow community, will count more than once a day, but they're still going to find a normal time. If they normally count in the morning at 8 o'clock, and normally count in the evening at 8 o'clock, they're going to stick with those time frames. So we're comparing and finding that pattern, and we're going to track how long it takes the baby to get to 10 movements. And so, it's not 10 movements in 2 hours, 10 movements in 1 hour. It's how long does it take my baby to get to 10 movements? It may take my baby 5 minutes to get to 10 movements. It may take Via's baby 25 minutes to get to 10 movements. We want her to compare her baby. Every pregnancy is different. Every baby is different. I experienced 3 different pregnancies with 3 different children, and my daughter was lightning fast. My first son was more chill. So that's, something that we want people to know, is that we're not comparing to other babies, other pregnancies, or other individuals. So after a few days of tracking, you're going to learn to, about how long it takes, kind of find that normal length of time. So this will improve the conversation with you as an outreach specialist or as a support, but it also improve that conversation with a provider, and it'll make them in tune of what if they notice a change in that. And we want them to call their provider right away. All of our talking points are we need to talk to our provider, but we want to strengthen that conversation with our provider. So the free Count the Kicks app is available in over 20 languages, currently available in 24 languages. It is available on Apple and Android products. I totally encourage you to go right now and download that app, get it on your phone. It's a great tool or resource of education that you literally can talk through in a client touch base. We also have a web-based kick counter you could use on your laptop as a source of education, or could be used by a client to count their kicks at the library or, at work on a desktop. So we want them to set a daily reminder. They can do that. Life gets busy. And so that reminder is like, oh, it's time to count your kicks. You can download your history. You can text it. You can put it in your medical chart. You can hold it up in an appointment. I had a baby. Loss and save mom say to me the difference in the conversation between her loss experience where she was like, I feel like something's off, like her intuition. We want moms to be in tune with their body and their intuition, but she's like, I feel like something's off, but I don't know how to quantify it. I don't know how to she was hesitant. She didn't have the education. The second pregnancy, when she noticed a change in movement and actually saved her child, she held up her phone and she goes, this is why I'm here. My baby's movement has changed. It normally takes my baby 10 minutes to get to 10 movements, and today it took, an hour and five. This is not normal for my baby. Like literally, she could hold up that data. And so it's like a data download of mom's intuition. And that is really empowering to be able to do that. So I am just letting the little video play here. So every day we're just going to hit start counting, tap that little footprint. The clock starts tracking it for you. There's education within the app. You can undo a kick if you made a mistake, or maybe you're including a spouse, partner of some sort, a sibling in your kick counting experience. They put their hand on the belly. That's another way to help bring that family unit into the experience, or that support unit, whoever that is. You also want to know about the strength of your baby's movement. Be in tune with that, because research indicates the strength of baby's movement can also be an indicator of health. And so from fluttery, those light movements, to fierce, you can rate that in the app. And then it creates basically a little chart or a graph and helps you understand your normal. We also have a contraction timer within the app. So that is a really powerful tool providers ask for, so they can count their kicks, but also as they get to the end of that pregnancy, they can keep track of those contractions. There are scannable print charts, that OCR technology that you use when you like upload a bank and check into your bank account, where you scan and it uploads information. If they are counting on paper kick counting charts, perhaps you have a client that you meet with every week or every couple weeks, however that works, they could be counting on paper, but you, if you have the app in your phone, could literally upload it into a profile and also have it as data to show there. Or they could upload it, maybe they were offline. In Florida, they use it as a part of their hurricane package, right? Like they have paper kick counting charts. And if they're offline, they don't have Wi-Fi, they don't have electricity, whatever, for their phone, they can still kick count on their paper charts. But when they come back online, they could get that information into the app, for example. There are digital badges, so that gamification, that encouragement, like, congratulations, you had 10 straight days of kick counting, or whatever that is, where they can earn those badges. And there's a My Zone feature. So think of social media scrolling, where they have their own profile, they're getting education, and finding information along the way. So like I said, 20 plus languages. The other thing that's really cool about our app, actually, my CEO and colleague, our program director, were at the Clinton Global Initiative this week talking about this AI feature. This is Ask Anna. She not only can you chat her, like text, like text type, you can call her and she will speak to you in more than just English. If you talk to her in Spanish, she'll talk back to you in Spanish. So we have responsible AI. Any question that mom asks is pulled from curated evidence-based education only. And so really powerful tool, and it is going to be cited information and drive them back to their provider so they can get evidence-based education and information right there in the app. Another important resource, and this is one thing, I'm not sure, Steve, if you've tested it, but in the app, we have, our app is tied to a national database called Find Help. And you can go in, put in the zip code, and then find low or cost or free resources in those social drivers of health categories, such as food, access to healthcare, daycare, transportation, dental care, etc. And so if your services are not in there, go to the Find Help website and add those resources. So that's another place you could be bringing expectant parents or those that you serve to the resources that you have. And our app would do that directly. So if you have a client that is suffering food insecurity, you could put their zip code in and you could literally pull up and help them find those resources right away. Right in that conversation you're having with them. So I think it could also be powerful resource for more than just kick counting. What resources do we have in LA County where we do have that partnership? Thanks to Anthem, there are free print materials. So you've probably seen it over my shoulder as well. Bright, empowering. It was really important to our founding moms that this not be a fear-based campaign, that this be an education campaign, a health literacy campaign that was empowering, easy for moms to understand, welcoming. And so we have created our traditional materials, which are written at a fifth grade reading level, but we also have our at a glance materials, which are more visual or picture based and at a third grade reading level. So really easy access to whatever population that you're serving. We are excited that these materials, these print materials are free. You can go to our website, www.counttokicks.org, and order these materials completely free, no shipping, nothing. They can come directly to you and you can disperse them into not only your clients' hands, but all those community partners' hands that should be educating and empowering when you're working with hospitals and clinics and wherever you go with your outreach, you literally could be carrying these tools and resources into those areas. So we also have kick counting bands. So I notice I said that we had a kick counting chart. We recognize that phones are a barrier. I heard it in the conversation before. Not everybody is going to have access to this app. In the state of Iowa, every Medicaid phone has the app uploaded. It's automatically there as a tool or a resource. I know that's not the case for everyone or everywhere. So paper kick counting charts are something that you could print off and hand to clients. There are kick counting bands you can order with instructions about how you count your baby's movements, where they just move from 1 to 2 to 3 and use a clock and a pen and paper. Badge reels. So if you want to have a conversation, you can have that QR code to download the app, literally pull it out for a client to do it right off that reference card. It has the talking points. So for you, like what you should educate on. These are the free downloadable kick counting charts, also free on our website in 18 languages. So trying to break down access barriers and provide more resources. We also have digital resources that are available in 17 languages. I think it's supposed to be 18. We're still trying to get one online. But this is something you could email, you could text, you can share on social media. So I know Steve and the communications team are doing a good job of sharing Count the Kicks in places and spaces. This is an easy win, an easy share, completely free. So we have all the different ways that you can empower and educate. We also have 2 social media channels I encourage you to follow. Count the Kicks is going to be more expectant parent facing. It's going to give that education on how to count, why to count, just really empower the audience and really target it at that expectant audience. But really powerful information on Count the Kicks on all those social media channels. And Healthy Birthday is our nonprofit organization, which really is working on that more systemic change. We helped pass the first piece of federal legislation ever created on stillbirth prevention, the Maternal and Child Health Stillbirth Prevention Act, which basically leverages federal dollars in the Title V grant for stillbirth prevention. We are supporting the Shine for Autumn Act to improve research and data collection around stillbirth. So Healthy Birthday is going to be talking about the stillbirth crisis. It's going to be talking about what you could do on state, city, and federal levels to really be involved in addressing the stillbirth crisis. So that audience is going to be larger or more wide, not larger, but more wide than that expectant parent community of Count the Kicks. So follow us on social media to learn more. Here at the end, we'll have some time for question answering, but I want to give some ideas of ways that I think your role could overlap in sharing Count the Kicks. So outreach specialists are doing powerful work. I've done some research on you. I have no idea all the amazing things you're doing, but what I have read is that you're making a big impact. And I just want to highlight that I know your jobs are difficult. So hopefully this is a resource that makes it a little bit easier to serve those prenatal clients that you have. Some really important things to highlight, some common misconceptions. My baby's always active, so I don't need to count kicks. And Via, if there's anything here that you really want to talk more about, please feel free to do so. But even active babies can experience a health crisis and they can experience it quickly. One of our lost moms says her daughter Liddy, who was her second out of four pregnancies, was my most active baby, yet the baby she lost to stillbirth. And she said she was so active, I actually stopped kind of paying attention to her movement. She's like, she's so active. If I would have spent 5 months, I might have noticed sooner when that changed. She goes, I kind of had tuned out, and I wish I had tuned in. Those that are only those with high risk pregnancies should be educated. No, everybody deserves to have this education. You shouldn't have to lose a baby to be considered high risk. So we want to stop that phenomenon from happening. We want to catch all warning signs in pregnancy. And stillbirth is actually more common in first time pregnancies. So just so you know. My baby should get 10 kicks in 2 hours. That is actually a myth that we need to break. That is outdated research and education and information. We want to learn your baby's normal. What's normal for your baby, the amount of time it takes them to get to 10 movements. And we want to be able to find those patterns in movement and speak to those. I just went a little fast. Sorry, I just passed something there.
I just
Uh,
want to also add, I'm definitely one of those first-time parents when I was pregnant with Victor, that my provider told me that I should be counting kicks, make sure that it would be 10 kicks in 1 hour. So just highlighting again the inconsistency in provider education to their patients. And also, I was one of those parents that also said, my baby is very active. I don't really think I should be counting kicks that often. And my mom was a nurse, love her, but at the time she also said, when I was pregnant with you, I didn't really count kicks. So, but now I know better and definitely want to highlight that once again, being consistent in education, at not just the expectant parent, but also the provider level is very important.
Extremely important. And we do, as a society, carry those myths. I was told some of these myths as well. Unfortunately, those myths weren't dangerous because I didn't need to have the education that Via needed to have. And so just debunking myths is really important. Thank you for sharing that, Via. My baby isn't moving. I should drink something cold or eat something sugary. This is actually outdated information and education, but something that's happening quite regularly. It really does delay finding out why that baby's giving that warning sign. And it could, it's kind of like tricking the test, right? Like there's certain rules when you take certain blood tests about eating, not eating, that type of thing. If baby's giving that warning sign, let's investigate. Better to be safe than sorry. Hospitals are open 24/7, 7 days a week. It's better to have that investigated and ensure that everything's well instead of missing that warning sign. Babies kick less near the end of pregnancy. Hopefully, by this point in the presentation, you've heard us say, no, no, no. They don't run out of room. They are active. They're living beings. They're active even up to and through labor. Now, how those movements feel to mom might be different. So the baby may still be moving about the same amount of time. Like they still may say it takes an average of 10 minutes to get to 10 movements, but it might be more instead of full rolls, that baby's like, in there tighter. It might be more that like elbow out the side, a push here, a kick there. I also want to highlight, we're not just talking about kick counting, we're talking about all movements. Rolls, kicks, jabs, pushes, all the movements except for hiccups should be counted. Hiccups are involuntary movements and should not be counted. So babies, how it feels to mom will change over time, but the amount of time or the pattern of movement should not change. I can just use a Doppler device to monitor my baby's well-being. Remember how we said heart rate is the last sign of distress? So we want to catch that early warning sign. So if you're using a Doppler, you may be catching the distress late, or you might be falsely reassured because you heard that heartbeat. You think everything's fine when in reality, it's not fine. The other thing I want to highlight, two other things, and why we don't recommend Dopplers is what you get off of Amazon and what the professionals are using in the clinic are very different tools. And the training received to run a Doppler is very different between a clinic, a trained medical professional and a mom at home. So she may actually be hearing her own heartbeat and not the baby's heartbeat and not be able to discern the difference between the two. So that's why we just think that movement should be the thing that mom is really most in tune with and responsive to if there's a concern or a change. Okay, let's see if we can get it moving again. Sorry, there we go. So let's connect the dots for you, thinking about ways that you can bring into your work. I don't want to tell you what to do because you actually know your work. You're probably sitting here thinking about how you do your work and hopefully how you can connect the dots yourself. But think about sharing with others, right? Like wherever you go in the community, and are there people that aren't in the room today that need to have this education? Steve, thank you for recording this. Hopefully, this is something that we can continue to share with others so that they also have this education information and can use these tools and resources. We want to make sure that we are thinking about how to address unique client needs, such as language accessibility, that we're culturally sensitive in how we approach that. And I think Count the Kicks can really lean into helping you with those types of resources and conversations. If you saw some of our materials or how we operate in the app, for example, encouraging consistency. It is a daily practice. It really is something that we want to create that daily practice. And we want to encourage you and everyone else to partner in that involvement. I say that what this can also do besides bonding, reduce anxiety, catching early warning signs, all of those things are great, but improving your voice, your advocacy voice in your provider conversation is an important part of this as well. And so giving that mom that voice, that confidence, to have improved conversations with her medical providers is important. Doulas are a huge part of the work that we do. So that doula community comes alongside this being in tune with your body, your baby, but also having that data download of mom's intuition and that empowering education. So if you work with doulas, if any of you are doulas, this is another community that needs to be educating and serving the populations with Count the Kicks education. So make sure that those touch points, and what if you don't have a touch point right at the beginning of the third trimester? What should you do? Have the conversation as early on. Is there a follow-up email communication that happens? Like, how do you get this education in the hands of expectant parents before they start the third trimester? So think about how you communicate. Is it email? Is it text message? You can use all of those tools with the resources we provide. You could text that digital resource and say, congratulations, you're entering the 26th week. If you're high risk, you should start counting 28 weeks. Like where is it those touch points that you can get this in their hands? And then every touch point you have with them in the third trimester or a medical professional has in the third trimester should center the conversation around fetal movement monitoring. So we just to like tie that in a bow, encourage you to use the mobile app and ask those that you're serving to use the mobile app if they have it or the other resources if they don't. We want you to be the source of education, like bring that health literacy into the conversation. Bring into the conversation with expectant parents and everyone else that you interact with and partner with that should have this. Be the bridge and eliminate those misconceptions. I think that's a huge part of what you can do for expectant parents and for providers. And, just like build into your process. And I heard the importance of process, where this could go. Think about that as a team. As a team, I'm sure you have ideas that you could bring together. So this is just an easy way to continue to incorporate Count the Kicks into what you do. I wanted to make sure you knew that we also worked with the National A1, that's the Association of Women's Health and Obstetric Neonatal Nurses, largest membership organization for labor and delivery nurses. And so we worked on a 3-year project, created a change in fetal movement course that you could take for CE training. So if you wanted to know what should happen at the provider level when a mom reports a change in fetal movement, this is the algorithm. So there was no standard of care. for what a provider should do when a mom reports a change in fetal movement. So this standard of care, this gap that was filled, is can be found in this course. We also have a Count the Kicks Champion program. If you think there are other places or spaces that need this, we have a program for them to implement Count the Kicks as well, or if within your programs, if you have other places or spaces. We also are hosting a day and a half virtual maternal health symposium focusing on innovative ways that people are addressing maternal health issues in their states, cities across the United States. Over 50 presenters. It is a wide range of individuals that are going to be sharing. It is free and worth CE credits. So it's another way if you are looking for those CE credits. I encourage you to think about looking into this opportunity to hear what innovative ways everyone from clinicians to home health visitors and public health professionals are working to create change because we don't want to be stuck on just discussing the problem. We want to be stuck on solution-based conversations, right? So that's what this symposium is. We invite you to that. And just looking at the time, I want to be cognizant. So I'm not going to share Destiny's video, but it is a great one telling her story about how she used Count the Kicks to save her child's. That's the goal. We want to partner with you. We know you want the same things that we want. We know that you are doing hard and important work, and we value that.